Imagine you're hit with a sudden wave of nausea, cramping, and maybe even vomiting. Your first thought? Did I catch the flu? But here's the thing, what we often call the stomach flu isn't caused by the flu at all. Confusing, right? You got your flu shot and still ended up sick, wondering, why didn't the vaccine work? Section 1, Stomach flu versus respiratory flu, the real difference. Here's where the misunderstanding starts. The flu shot is designed to protect you from respiratory flu, caused by influenza viruses. These viruses attack your lungs, causing symptoms like coughing, sore throat, and body aches. But stomach flu? That's an entirely different beast. Officially known as viral gastroenteritis, stomach flu is when your stomach and intestines get inflamed, causing nausea, vomiting, and diarrhea. And spoiler alert, your flu shot doesn't stop this. It's a bit like locking your front door to keep burglars out, great for one type of threat, but the stomach flu sneaks in through the back window. The confusion makes sense, but understanding the real cause of the stomach flu can help you manage it better. Section 2, What actually causes stomach flu? You might be surprised to learn that several viruses can cause stomach flu. The most common culprit? Norovirus. In fact, between 19 to 21 million Americans deal with norovirus infections every year. That's like filling up Madison Square Garden over 900 times. Other viruses, like rotavirus, can also trigger stomach flu, especially in infants and young children. But here's some good news, there are vaccines to protect against rotavirus. The rotavirus vaccine isn't just a one-off, babies get their first dose before 15 weeks old, and the full course is done by 8 months. For instance, this vaccine can be a lifesaver, preventing one of the leading causes of severe diarrhea in children. Section 3, The flu shot myth, why it doesn't help with stomach flu. So, why doesn't the flu shot cover your stomach? It's simple. The flu shot targets influenza viruses, the ones that cause respiratory issues, not the ones that mess with your stomach. Think of the flu shot like a security system for your lungs, but it's not designed to deal with invaders in your digestive system. Now, a quick heads up, some people experience mild side effects after getting the flu shot. Symptoms like nausea, headaches, or muscle aches are pretty common. And if your child gets the nasal spray version of the flu vaccine, they might even throw up. But this isn't the stomach flu, it's just a reaction, and it's temporary. Section 4, How stomach flu spreads, and how to dodge it. If there's one thing the stomach flu is really good at, it's spreading. It's sneaky, like an invisible villain in a spy movie. You can pick it up just by touching an infected surface, like a doorknob, elevator button, or even a shared spoon at dinner. Gross, right? And if you eat contaminated food or water, it's game over. But here's the good news, you can fight back with some basic hygiene habits. Wash your hands often, especially before eating or after using the restroom. If you've got little ones in diapers, wash your hands every time you change them. Disinfect surfaces like toilet seats and sinks, and if someone in your house gets sick, wash any clothes or bedding they've touched. These simple actions can make a big difference in keeping the virus from spreading. Section 5, Treating stomach flu, the simple path to recovery. Here's the silver lining, most cases of stomach flu clear up on their own. You don't need a prescription or a magic cure, just patience and plenty of fluids. The key is staying hydrated. When you're losing fluids through vomiting or diarrhea, you need to replace them. Sports drinks, broth, fruit juice, and water are all good choices. If dehydration starts to kick in, rehydration solutions like Pedialyte can be a lifesaver. Rest is essential, too. Your body is working hard to fight the infection, so give it time to heal. For most people, symptoms start to improve within a couple of days. But if things don't get better, or if you notice signs of severe dehydration, like dizziness, dry mouth, or little to no urination, it's time to see a doctor. Section 6, When to seek help, warning signs to watch for. While stomach flu is usually manageable at home, it's not something to ignore if symptoms take a turn for the worse. Dehydration is the biggest danger. In kids, the elderly, and people with weakened immune systems, it can be especially risky. So, what are the red flags? If you're feeling lightheaded, have a high fever, or notice blood in your vomit or stool, these are signs you need medical attention. And if diarrhea lasts more than a few days, or you can't keep fluids down, don't wait, talk to a doctor. Section 7, Prevention, your best defense against stomach flu. While there's no vaccine for every virus that causes stomach flu, there's still plenty you can do to protect yourself. Start with the basics: wash your hands, clean common surfaces, and be mindful of what you eat and drink. These simple steps can make a huge difference in reducing your risk. If you've got a baby or toddler, getting them vaccinated against rotavirus is a smart move. And while the flu shot won't stop stomach flu, it's still incredibly important for keeping the respiratory flu at bay. That way, you're protected on multiple fronts. Conclusion: taking control of your health. So, here's the bottom line: the flu shot is a powerful tool, but it's not a catch-all. While it won't stop stomach flu, it does a great job protecting you from respiratory flu. And even though stomach flu can be miserable, it's usually short-lived and treatable with some good old-fashioned rest and hydration. Remember, the key to protecting yourself and your family is prevention, whether it's through vaccines, hygiene, or knowing when to see a doctor. Understanding the difference between the flu and stomach flu is just one way to stay one step ahead of illness and take charge of your health.